types of research broadly are two: quantitative research and qualitative research. Quantitative research deals with numbers. It gives information about quantities, and so it gives an estimate of the magnitude of the problem and distribution determinants, as I have told you earlier. While qualitative research deals with phenomenon that can be observed but cannot be measured, that can be described only in languages, in words, etc. So that gives us an insight into people's behavior, why people behavior in the way they do. So these are the differences between qualitative and quantitative research. So quantitative is based on numerical sciences, as I told you, and qualitative is based on behavioral and social sciences. So quantitative is objective, this is subjective, this one is estimation of the problem, and this is exploratory. Qualitative is exploratory. We want to explore into the human behavior, into individual behavior, into group behavior. I have described in the earlier session on behavioral sciences. So we want to see that what is the people's behavior and why are they behaving in this way. So all this can be understood by the qualitative research, and also what problems they are facing, etc. So here quantitative's purpose is to identify the problem, and qualitative is find reasons for the problem, why they are having this problem. Quantitative needs a large sample size. Here it is a smaller sample size that will do. Sampling technique is probability sampling technique in quantitative study, and in qualitative non-probability sampling technique can also be used. This you will understand when I discuss sampling technique later in another session. Then method of data collection. In quantitative research, it is structured. The tool that we use, the interview schedule that we use to collect the data from the subjects is structured. We have options, and it is partly semi-structured also, some open-ended. Basically, we have two types. One is structured, where we give options which the people can tick, or another is open-ended or unstructured. That is, just ask the question and leave blank. Let the person say whatever and note down everything. And semi-structured means when a performer or a data collection schedule has some questions as structured, some as unstructured. Like we say the name is open-ended, the name has to be written. Then we can write the gender. We can just write male, female, others. We write male, female and others. So while collecting the data, it can just be ticked. So this is all options are there. There is no response beyond this. So this is a structured type of a question. Now age, when we write, we keep it blank. So many years. So that means this is an unstructured question or open-ended question. So that the number has to be written. So many years, 10 years, 25 years, 52 years, whatever. We can make age structured also if we write 0 to 9, options if we give 10 to 19, and then any one can be ticked. So this becomes a structured one. So I hope you have understood the difference between structured and unstructured types of schedules. So in quantitative research, many times it is structured but semi-structured also. In qualitative research, it is most of unstructured. We just ask the question, why didn't you go to the health facility earlier? There's no option. We can't give any option. The person will say why. Maybe there was no one to accompany me, or maybe we didn't have the money to pay there, or maybe I thought that it is not so much of a problem and it will resolve on its own. So whatever the subject comes up with, we have to record that. So there is no option. Qualitative research gives us an insight into all these problems. Then assessment for quantitative is result oriented. So finally we have to identify, estimation, the result. We focus more on that. In qualitative research, it is the process which is very important. We identify in the process, and for the data collection, we have a topic outline guide. That means some questions are there, but it is not so hard and fast that we have to stick to it. We may deviate from this a little bit, because as and when the person responds, so based on his or her response, we may add new questions. So the process is very important, how we finally take the subject through the interview, and finally we in the end assess the whole situation from the perspective of the subject. Then in quantitative research, I told you it is numerical. So numerical and measurable. And here it is qualitative is verbal, it is written, words, phrases, sentences, etc. And even non-verbal can be noted down. Like when we asked to a lady, a married woman, having some problem, maybe having, say, vaginal discharge, and we asked, why didn't you seek treatment? Why didn't you go to the health facility earlier? Then from her facial expression, we can understand that she's embarrassed. She finds this a very embarrassing situation which should not be discussed at all. So then we get the idea that is the reason she didn't disclose it to anyone. So no one knew that this is actually a problem that she's suffering from. So from the non-verbal or the gestures also we can get some data, and we have to note that down also. While I asked this question, the person was visibly embarrassed. So that also gives us an insight into something else. So that the stigma in the society regarding any reproductive problem, so that also needs to be counseled and done away with. Next is assessment. As I told you here, frequency, distribution and determinants. In qualitative, we want to find out how people think, how people feel, and how do they behave. Like this example I gave you for vaginal discharge in a married woman who couldn't take treatment. Why? Because she said some reasons. There was no one to accompany me. She said, I thought it will resolve on its own. But the look on her face or the way she suddenly behaved, we realized that she was embarrassed. So maybe she has not told anyone.